Save recording here. Okay. I'm also going to share, we have just a very simple PowerPoint presentation to share, just some slides to get us thinking. So I'm going to share that now. Um, you all know how Zoom works. So if something doesn't look right, you let me know. And we can talk through this or around this basically, but um, the purpose for our thinking about this is that we live in that, what's the curse? May you live in interesting times. Right now we live in interesting times. Um, and I was really excited to get some colleagues and grad students together to talk. I know, for instance, that Sterling Courtney, who's here with us, is a medical professional working in the hospital settings here in Orlando, and so has a lot to share specifically about this topic. But because of the pandemic conditions, the ways we think about ethics and the things especially our graduate students are thinking about now, are shifted slightly from the things they were thinking about even 6 months ago, or shorter. So we wanted to think through that with you here. We've got people coming in and out of the meeting, so I'm trying to keep track of that too. What can you all see? Should I go into presenter mode in the slide?
I think I would.
Okay, there we go. Now you can see a fancy slideshow. I just want to check. Mike, you've been coming in and out. Are you here with us now? Yep, Mike's here. Good. Okay, excellent. If you've got any questions for me along the way or for Steve, please feel free to jump in. Oh, hold on, he said. Okay. So one of the first things we wanted to think about are impacts. We've sort of broken this up into thinking about the things that are challenging in the pandemic conditions, and then moving our way to ways that we can think about them or reason through them, sort of the ethical decision-making part of things. So what we wanted to start with were some of the impacts. And some of these are pretty obvious. Our graduate students and our colleagues are thinking a lot now about health impacts, specifically of the virus and the pandemic. So part of these are going to be, we're all going to end up knowing people who have passed away. And we've all seen, I'm sure, social media posts about famous musicians and friends and colleagues and family members who have passed away now, specifically from COVID-19. And another piece of this, a way we're trying to keep this down, is the new conditions under which we all live and work, and that is by ourselves, alone. And some of this, for some of us, this is more alone than others. So and you might see them or hear them during this Zoom meeting, I'm in my house with my family and my children and my animals, and that's one kind of social distancing. And others are more alone, and some people are less alone. In fact, Florida's beaches reopened, if I remember hearing about it yesterday. So some folks are less socially distanced than others. But these conditions of being separated from one another or combined just in virtual spaces is really challenging.
Yeah, and then adding, to isolation, that means many of us are not able to go to our workplace. We're in such a fortunate space. For many of us in the university environment, there's a lot of work we can keep doing. But for the service industry, so many people have been furloughed or staying at home. Obviously, we're all aware of the concern that small businesses have of possible closing. So then there's a health impact, and then so many people are thinking about downstream economic impacts. And for us in Florida, even if we are in the university and might feel isolated right now, down the road, of course, the concern is how economics will impact Florida revenue and what that will do to the university. So economics is something that's weighing on people's minds, and we're seeing even that begin to be discussed and becoming a hot topic of debate or even protest, where people are saying, well, the economic impacts are beginning to outweigh what they perceive as the health ramifications, and so we should start opening up quicker rather than slower. For us in learning, in teaching, we're learning how to do more online teaching and learning. And we've had online training at the university for some time. Many of us have run courses totally online or mixed mode, but now we're trying to find creative ways to do everything online. Dr. Geiger is with us. In chemistry, we think of chemistry as a lab science, the program that she directs, our department, and she, among others, are trying to struggle with how do you do lab training totally online and make it a meaningful learning experience. So it's really bringing to the head, in some ways, I guess, discussion of online learning, how effective it is, what needs to be changed, how can we best leverage it, and what will the future look like going forward.
One of the things that's driven the Center for Ethics so far has been our connection to the Office of Research. And we've been thinking quite a bit about the impacts of pandemic conditions on research. And especially coming from the humanities, I've been thinking a lot about this because we've been all reading quite a bit about the ways in which pandemic conditions or social isolation might help or hinder humanities-based research. A lot of my colleagues are turning specifically to think about COVID-19 and pandemic conditions, say in the Anthropocene. But more generally, I think there's some interesting space to think about issues about the ways in which we get work done and finding mental and psychological and physical space to do that work. So as a, for instance, I know some of my colleagues in my same career path or career point are feeling really good about the pandemic because they're just basically at home, maybe with their partner, but just at home, and they're able to work. They don't have to travel anywhere. They've got extra time. And there are others of us who, because of family conditions or other conditions, even though we're home and isolated, we're separated from the spaces in which we can get research done. And this is especially true of my colleagues in the STEM sciences, like Steve and his colleagues, who need lab space and graduate student support in order to do the work they normally do. So our research is being affected not just in what we study, but in how we go about studying it.
Also being impacted really is the increased need for research. Obviously, we're dealing with a health crisis, and the whole of society is recognizing, partly due to lack of knowledge, the need for research to really address the problems. And I guess one of the things coming to the fore is how you balance resources and needs. It costs to get the research done, especially to get it done quickly to address COVID, and then where do you put the money? So that kind of jumps ahead to the idea of value conflicts. But should, for instance, funding and resources go into prevention, into testing, into development of antibody screening, or into other remedies, or into generating infrastructure to help with healthcare? So resource management and facilitating research and the need for research is also something that I think is coming to public consciousness. I've also been really interested in the notion that those of us who are stuck at home are actually quite privileged. There are many at-risk groups who are profoundly impacted by COVID in ways that many of us, fortunately, cannot understand in a real way, myself included. But if you think about people who are homeless, they're incredibly at risk. They don't have the luxury of being able to shelter at home. Another at-risk group are people in situations of potential or real domestic violence, where for one partner, the other partner going to work in the day was the respite and the opportunity to regroup and mentally balance. And then when that partner comes home, it's walking on eggshells because there can be physical or mental abuse. Now, if we are all working from home and that partner is in the home 100% of the time, there is no longer an escape from that stressor. And in fact, those stresses of whatever of the relationship and whatever is maybe antagonizing the aggressive partner is now exacerbated by COVID. So there's been a lot coming out of the UK and a little bit starting to come out of the US about how at-risk groups and potentially and particularly women in situations of domestic violence are having to deal with an additional impact that I think, fortunately, many of us can't really appreciate except peripherally.
And in each of these categories, we could, and I hope we will as a group, but add to these. So I also, when I was thinking about at-risk groups, I was thinking about veterans and the elderly and homeless populations, all of whom are at medical risk in ways that maybe perhaps we aren't, and the ways in which we can be socially isolated. Um, Steve, do you want to talk a little bit about voting in democracy?
Yeah, I mean, it's very interesting, on one end to, be aware of and recognize a lot of finger pointing that happens in a time like this. Who's in power, who's not in power, what should we have, could we have, or would we have done? But it's I think more useful actually to think about proactive measures and understanding how the current situation is affecting our democracy. Just the access to voting is an issue, and we saw that play out in Wisconsin, where at least one political group was calling for primary elections to be delayed for COVID, so that more people could come out and vote when they felt there was less health risk. And those in power were actually saying, no, we got to get it done, and claiming that voting by mail is compromised. So regardless of where anyone may come down on those issues, there's clearly conflict being generated in terms of how we execute our democracy. Thinking ahead for the 2020 election, how is that going to be done, and what might future elections look like? It was interesting to think that with all of the recurring problems coming out of Florida, there was a drive to get more toward paper balloting, and now it looks like maybe online mechanisms for voting may actually be needed in some circumstances. So that's something that certainly got to be thought about and dealt with. But also interesting is ourselves. Oh, it says my connection is unstable, so hopefully you can still hear me. But we think of ourselves as a true democracy, but we're really a representative democracy. And we also have this constant tension, sometimes productive, sometimes not, between federal rights and states' rights. And as we see states debate whether or not they should stay closed or open up, we're seeing that tension between states' rights and federal rights. And it's interesting to me because I think there's a scaling issue here. So if we back away from just state versus federal issue, think about individuals. An individual can have personal liberties that drive them to say, hey, I'm not sick, I want to be outside, you're infringing on my personal liberties. But then competing against that is the need for maybe social responsibility and the needs of a community, where the needs of the community are, no, you need to stay at home and sacrifice some of those liberties. So if we just scale that up now and think about state versus federal needs, an individual state that's maybe rural and doesn't have much of a COVID outbreak could understandably be saying we don't need to isolate. And yet the issue is that if the virus continues to spread at high rates, it can move into other states. So just because you have obviously political boundaries, that doesn't mean you have boundaries against spread of a disease. So where do maybe the needs of the other states and the federation maybe outweigh the rights of the individual states? So it's interesting to think about how the personal versus the community values there are in conflict, and how that scales even up to what we see in our unique US political situation. Technologies is for you, Jonathan.
It's for all of us, Steve.
Yeah.
Yeah, when we've been trying to, as we tried to list out some of these potential impacts, one of the things that keeps weighing heavily on me are technologies. Voting is a great example. Steve, as you mentioned, I mean, just thinking about the shift towards electronic voting and everything that might bring with it from a technological standpoint, there's all sorts of issues there to unpack, but you could think about technologies from medical technologies. So everything from the development of a vaccine in the future to trials, testing drugs that may or may have not been suggested by the president, who knows? Tracking people, whether or not we track, and the ways in which we track people's social connections to try to tamp down the virus, the ways we make social connections. There's all sorts of things now. The university has contracted with Zoom. A lot of corporations now are backing away from Zoom due to potential privacy concerns. So the ways in which technologies impact us are yet another sort of one of these viral impacts, the things that are impacted by the vaccine because of the virus. Now, in each of the categories we've listed out, I think the way we've sort of thought through this is that the ways in which the pandemic has brought these issues to the foreground is just that, is to foreground them. It's not like these are novel problems brought to us by the pandemic. It's that the pandemic has exacerbated particular issues to make us focus a little bit more strongly on them, or to bring them at least to the social consciousness. And I wanted to pause here and just ask if there are other things that you could think of that we've left off the list, other potential issues. We initially had thought that this might be a good space to do some breakout sessions with, say 300 graduate students. But I think it would be really interesting to think with you all about the list here that we put together and the ways in which it might be expanded. So does anybody have thoughts about other impacts that didn't make it on our list that we could add? And I think we've got this fancy ability to annotate directly on our slides.
Can you hear me?
I can, Shelley, yeah.
Okay. It seems to be one of the.
Oh, no, I can't.
We might come back to Shelley. Becca says that she has one. So Shelley, we'll wait for you to stabilize. Maybe Becca, you
things
can.
that's been left off.
Oh, there we go.
Still there, Shelley?
Classism hasn't been obvious, but gender has come to the fore recently too, in terms of the vast majority of people in the so-called essential services, whether it be nursing or it be
Oops, Shelley, you froze for us, I think.
other kinds of
I think maybe what we need to do, Jonathan, is let Becca go forward and mute Shelley, but I'll send her a note for us and ask her to check her online connection so that we can come back to what she had to add, because these are some really good points. Does that seem like a plan? Okay, I'll work on that.
Okay. Becca, do you want to?
Can you hear me?
I can, yeah.
Okay, cool. So one of the things that's kind of relevant to me is, so being in healthcare workforce, so the future, physical therapists, nurses, people who aren't going to be able to sit for exams, aren't going to be able to generate the workforce needed to take care of the folks that are ill, I think could be a big societal problem depending on how long this goes on. And I'm sure you considered as at-risk groups as healthcare providers themselves as being one of the higher rates of infected folks, but that also kind of goes to resources as far as how are we protecting the healthcare workers that are on the front lines. But those are kind of two things that came to my mind when we were talking.
Excellent. Yeah, thank you very much. Yeah, you and Sterling both coming from healthcare workforce backgrounds from slightly different angles, but I think are both thinking about many of the same things. It's really great. Thank you.
Well, I do have some input on exactly what she said and the technology, which has changed tremendously.
Please go ahead.
Okay. Well, so one thing, I guess it's been 3 weeks now that I checked, and I was just on another computer trying to find the available technologies. But as of 4 weeks ago, when I checked the CDC website, there were 22 available methodologies and tests for this, for the diagnosis of COVID-19. Never in my lifetime, and I'm one of the senior members here, have we seen such a basically FDA or whoever has to do the approvals, sit down, sit on your hands, and we're going to roll these technologies out. Now, based on that, the methodologies may be more or less reliable. So I've seen in the little place that I work, we send, if you're a patient and you're not being admitted, your COVID test gets sent to a reference lab, which could take 4 to 7 days to come back, for the results to come back, and you're told to convalesce at home. If you're being admitted, it goes, your testing goes to the hospital that you're being admitted in, and they'll try to get a turnaround time in about a day.
Okay.
So Advent Health was very proactive, and I mean, I remember looking it up, March 18th, they had a new policy, new instrumentation, moving their old instrumentation to the satellites and trying to get those up, and they're still trying to do that to lower the load of testing and maybe not have to do so many send outs. On the other hand, Orlando Health, we're sending their stat COVIDs to Advent Health. And I personally know that laboratory director got in a lot of trouble in lieu of that. So, but what I'm trying to say, sometimes these reference tests, they've come back with a different result than the testing at the hospital. And in the past, there was so much development of the methodology. You'd see, you know, how many false positives are there, how many false negatives, which one is more reliable than others. So in this technology development, from my point of view, it's almost like stand down. We're going to roll these methodologies out, and this instrumentation out. And I won't say completely, regardless of how sensitive or specific they are, but we've got to get something on the road. So I believe as of 2 or 3 weeks ago, or three or 4 weeks ago, there were 22 different companies involved. So, and Advent Health is using 2 different methodologies and companies to do this. So.
Yeah, that I wanted to jump in there because this is what you had to say there, Sterling, was part of my excitement about things we're doing in the center. Having someone like Sterling, you know, who's a non-traditional student, comes with this perspective from industry. Now in this time and place, perspective from healthcare, you offer an insight that many of us could not enjoy, and that's really interesting. And it's something that I wondered about, maybe read a little bit about, but hadn't heard firsthand accounts as you are articulating, that there really is an acute need that is causing a compromise between standards of technology development that we would normally require in order to meet acute need. And so, you know, then that's a new kind of value conflict. What do you roll out? What protocols do you use? What are the downstream risks that you accept and anticipate, and hopefully are not too great, that you can justify rolling out a technology before it's really been established? And then what are some of those potential impacts if you have more false positives or false negatives? I've heard conflicting information, for instance, about whether COVID can be recaught, whether you really develop immunity, or whether those kinds of data are the result of false negatives for tests that were not working well. So that's a lot of things that I see. I'm really glad you're here to offer that insight.
Well, and if I could hit on what a lot of people are saying. So Becca, you mentioned the healthcare workers. I work with 2 nurses that have already put in their resignation, suiting up. They're heading to New York for contract labor. For, I think one's going for 9 weeks, the other's going for 12 weeks. But in the 12-week period, they're getting contracts. They're staying in hotels. Apparently, they're not worried about anything as far as wading into the fray, and they're getting paid a substantial, like getting a year's salary for 12 weeks of work. Maybe not that much, but 6 months salary for 12 weeks of work. And one gentleman has been there 2 weeks, and he came home, to back and forth. He's going back and forth. He had 4 or 5 days off, and his wife told me that he said they're bumping into each other up there. There's so much contract labor. They really proactively hired all this healthcare, and now they've got plenty of PPE and everything, which really tended. I heard a doctor say the other day that a strange thing about this virus is viral load. So the fact that you may sit down at a desk that somebody had it prior to you, the viral load could be very low to where you could be completely, you might get it and have no symptoms, or you get a light case and your recovery will be very quick, versus the viral load that they saw from healthcare workers wading in without the proper PPE and completely covered. They were getting huge viral loads. So, and also the population in New York City, where people are on top of each other and coughing, so the viral load was really strong. So, and a lot of viruses, you don't, I'm not a virologist per se, but apparently viral load is not, you know, you're either exposed or you're not, but the quantity is not as impactful. So that was part of this. And there's some other symptoms that we're seeing with this that are really odd. And I work with a coworker that works in a specialty coagulation laboratory, and they're seeing advanced thrombotic activity post this disease. So I mean, I'm hitting on a lot of the topics there on your grid, on your slide, but they're wondering if the cytokines released from the lungs to handle this after, during the healing process, they're actually creating a lot of clotting issues. So people could be found to be put on anticoagulants if they have contacted this. That's just very preliminary, just kind of people having something to say, or they're seeing trends. So I'll step back and let someone else speak up. And if you have any more questions for me, I'll be glad to answer if I try.
Shelley might be back online, Jonathan. Maybe we could go, I think I see her in the participants list. Maybe we could go back to her.
Yeah, I am back. Can
Great.
you hear me now?
Yes.
So going back to the class and gender issues, in addition to women being a core and majority group of the essential service workers, they are also the core and essential work that are keeping homes together as paid and unpaid domestic laborers while children are off school and so forth. And then in addition to class and gender, as I'm sure many of you have been seeing, the race disparities in terms of death rates and mortality rates are pretty atrocious, and highlighting inequities of healthcare, inequities of testing, and so forth, as well as who's disproportionately in essential services. So I don't think that we can look at the ethics of these things on any of these things, whether we're talking about voting, whether we're talking about social distancing and isolation, or illness and death. Any of these things need to be thought of through the lens of things like class and gender and race.
Yeah, one of the big public health approaches that's getting a lot of attention again is the One Health approach. Not only, from my perspective, not only do pandemic conditions like this bring renewed focus to issues of class and gender and race, but they also bring renewed focus to environmental and non-human animal issues, all of which we tend to handle both from a policy perspective and from an ethics perspective as distinct, right? We could teach or take a class on animal ethics or environmental ethics or gender issues, and it's pretty rare, and that's also handled differently at the policy level, both institutionally, like at the university, and nationally. But the One Health approach, which was started by the AVMA, the American Veterinary Medical Association, the One Health approach is supposed to be bringing those silos together, so getting, in this case, researchers and healthcare workers from those three areas: environmental health, animal health, and public health, thinking together about the ways that, say, zoonotic transmission of disease brings about impacts for all of these areas. Now, to the extent to which that works very well is interesting, because each of those is so complicated. But it's been compelling to me to watch that literature sort of explode in the last couple of weeks, even, where people are thinking, oh yeah, this has been around, this is a theory, and now we've got a real life, real world example of how you can't separate class and gender issues from environmental issues, which we know pretty well, right? But you also can't separate those issues from animal health issues or from public health issues more generally. And something like a pandemic, something like this pandemic, brings those to the public consciousness in a way, into the academic consciousness in a way that oftentimes gets ignored or siloed away. So that's been really important for me to think about too.
You know,
Another thing I was going to add is I think it's also bringing new light to movements behind prison abolition. Do with that as you may.
Yeah. We've read numerous reports now about how the disparity of impact from prison populations, or populations that are sequestered together, whether that's prisons or nursing homes. But prisons are especially important because they bring together all of the things Shelley's been talking about, right? Disparities there between class and gender and race are important to consider, and now coupled with disparity in health outcomes is kind of really scary. So I've been reading a lot of states now are creating really low, if not $0 bond for minimal offenses. They've been letting parolees go early. So there've been efforts at least to address those problems. And the same thing is happening in, not to equate the two, but the same thing is happening in a lot of nursing home populations too, where the same sort of disparities are leading to the same sort of really impressive health crises. That's really good. That's a lot of impacts. We could keep talking about these for a while. I don't want to belabor the point, but I'll pause here and just ask if anybody else has more comments. We've got one chat.
I have one more I'd like to put on the table, which is rethinking what productivity means.
Good. Yeah, Julie Donnelly.
Especially in the university.
Awesome. Yeah, in the chat window, you can see Julie just posted a link about productivity. Do you want to say anything more about that, Julie?
Well, I just thought, you're reaching out to graduate students, and so if any of them, specifically women, are watching this later, that's an article that they're just starting to do a little bit of research in that area. But I feel like some of the quotes in there from the women who are talking about their experiences, I could have said the exact same thing about, taking care of my children while I'm trying to also do my full-time job. And their husbands may have, their husbands' employers have a higher expectation for them to be able to work all hours than they might have for me, if that makes sense. I don't know if that made sense, but this has definitely been a struggle for me. And I think for graduate students who are trying to, move towards a dissertation, this could be something that maybe will just at least show them that they're not alone.
Yeah, and Julie, I can say just I'm working with 4 or 5 PhD students right now in our Text and Technology program, and across the board, I've heard that same thing, no matter their home conditions. So I've got some of your colleague graduate students are living by themselves, right? But they're also under incredible amount of stress. But it's exacerbated if you've got children or others at home to care for, and you're playing that role of a primary caregiver. Yeah, I've also been reading a lot about how some really thoughtful people about how we have to start letting go of the notion of the value of productivity, like the idea that what we should be doing in our time is typing, right? Like thinking grand thoughts and getting them out and pumping out articles. Like the way that we live our lives is being challenged, and the way that we're supposed to be thinking about what you're supposed to be as a graduate student, right? Your job as a graduate student is not just to produce. I mean, you're paid to produce, but that's not what you're that's not who you are, right? And I think we're really trying to rethink, both from the faculty side and from the student side, what we're supposed to be. And both the social isolation angle, but also the shifts in the way we're being productive and capable of being productive are letting us have those conversations. So in some ways, I hope that's good.
I could see that it may be exacerbating our challenges, but also hopefully bringing them to light and maybe getting everybody to think about how we can overcome them. In this article, they talk about what the journals are thinking about trying to do to deal with these situations, and some of their ideas are not good. And I think that they're getting that message based on people's reaction. So maybe it's a, you know, the silver lining is that we're having the conversation.
Yeah, that was, again, yeah, thanks, Julie. That's really great. And that's part of the reason why we wanted to do this webinar. I know it's not the best time and everybody's has a lot going on, but just the chance, this is what's so important about ethics to me, and I think to many of my colleagues, we need the chance to talk together about these things. It's really hard to, you know, you can read some really interesting articles and you can think about it on your own, but thinking together is the way that we can bring about institutional change if it's needed, whether that's from the publishing end or whether that's university policy. I think UCF has been really thoughtful about the way they've handled this pandemic conditions and trying to get us all set up. But I think, again, these conversations, think first about mapping the ethical issues, which is what we're doing first. This is a way of we become sort of sensitive to the issues that one another are facing. So mapping these out, these viral impacts, we've called them, has been a really important first step. I think I'd like to move on to the second step, if that's okay. Debbie's got a comment. Go ahead, please, Dr. Reinhardt.
I had my hand raised.
You did. I saw the little blue hand.
Well, I was gonna discuss the gender issue, but it's been well discussed. And this may be a bit tangential, but I saw you were talking about risk research. We have a task force now that's looking at how to reopen the labs, and one of the things that we're talking about is priority. So who gets priority? We can't open up 450 labs to thousands of students and faculty. So how do we establish priority? And there's a small subset of the task force is looking at that. I'm not on it, but it just seems to me it has all kinds of ethical connotations to it. That, you know, should it be the new faculty? We've already made a priority for people looking at COVID-19 research of any kind. They're already back in the labs, but just how do we just make odd days? You can go in, or this floor can go in. Monday, Tuesday, Wednesday. I know. I just thought I'd bring that up to the group.
Yeah, thank you. I'm really glad to hear that there's a task force thinking about the conditions. And then I assume conversations have already happened about how to handle research that may involve non-human animal subjects or human subject research. Like those things, it's really hard to just pause if you're working with laboratory animals of any kind. So in some ways, research, there's all these levels, and it's not a value claim necessarily, but all sorts of levels of types of research we do. It's pretty easy, more or less pretty easy, for me to continue to write, say, academic articles from home from the humanities perspective. But on the other hand, I'm running a soundscape ecology lab, and that work has functionally shut down, right? So there's even within my own research profile, there's prioritization happening, which is really interesting. Yeah, thank you so much for that. I'll pause here. Steve, do you have any other comments before we move on?
No, that was good. I mean, I like that also, Julie moved us also towards some positive impacts. And I was going to add one that I hope one of the things that our students will appreciate is just how powerful education is, because as we see understanding starting to emerge of what COVID is, or even just the numbers that we use to track it, what an exponential graph is, what it means to flatten the curve, all of these things, which are, slightly challenging topics, the power of education gives you a tool with which to grapple with those and to, make better decisions. And I hope that one of the things that gets out there is really just how important society's proper support and emphasis on education is. And I hope our students can feel that empowerment and be great advocates to strengthen our educational system nationally.
Yeah, thank you. That's great. So again, we had wanted to start with you by mapping out impacts, and we could as we have spent quite a long time just thinking about all the ways that pandemic conditions have brought about new impacts. But the next step for us, oh, see, this is,
You just
I'm
have to go
learning.
to your annotations and delete them all. I think.
That's very
If
sad.
you did it with an annotation.
Okay. Ta-da.
Hmm.
Okay. This is why we've recorded. This is good. So if we move from impacts now to, the transition here for me has always been, when we map out impacts, any of us has something to say about them, right? So we've got policy concerns, some of which, like Dr. Reinhardt had brought up about the task force. We've got biomedical concerns, some of which Sterling had brought up about the ways that testing is happening, say at Advent Health. There's lots of different disciplinary approaches or professional approaches to thinking about those impacts. But from an ethics perspective, the thing that drives all these impacts for us are value conflicts. So what are the values at the heart of these issues? What are the values that are conflicting, which make these prevalent or relevant issues to discuss? And again, here we've done the same sort of task, Steve and I, trying to map out some of these value conflicts. And I'd like to think with you about them just for a couple of minutes and see if there are any others that you could think to add. So some of these are pretty obvious, I think. So liberty and the public good was one of the first ones that we mapped out. There's a lot of things here that we could lump under the category of liberty and the public good. And here's the conflict, right? On the one hand, we want to protect the public, which is why we're socially isolated. On the other hand, and there's some real frightening real world cases of this, there are people who desperately want to hold on to their individual choice, to their freedom. So this has led to protests on the state capitol in multiple states now, people deciding that they don't want to social isolate because live free or die or something, right? And what those people aren't thinking very carefully about right now is the value conflict, right? What does their individual choice do to the public good? And vice versa, what does limiting your public choice do for the public good? And this sort of tension is something, again, that's not new. It's something that drives how the United States and modern democracies function, but it's brought to the forefront because of the pandemic conditions. Yes, and thank you, Julie. We could.
Yeah, the physical versus mental health conflict is very interesting. Though all of the isolation is driven by a need to achieve improved health or maintain health, and yet for some, isolation is one of the most deleterious things that they can experience. And we've already seen connections between we've talked about mental health, which obviously connects to spouse abuse and connects to the gender issue. So these things are inextricably intertwined and very, very complex. But even within one framing, health, you can see value conflicts that emerge.
And again, you can think back to our list of impacts, and this is something you can do offline when you can go back and review. But you could think about all the ways in which some of the impacts can fall under these value categories. So which of these impacts are driven by conflicts between liberty and the public good? The same thing between safety and security. The example that came to my mind here was the development of drug tests, the speeding up of drug tests and development of vaccines. We usually move very, very carefully and very, very slowly in testing with human subjects, thanks to historical conditions, right? This is the way our biomedical research industry is set up. But there have been a couple of cases, international and domestic now, where we've moved really quickly, and that's led to some really bad outcomes. And again, there are reasons for that. We want to drive the safety of the public and the safety of each other at the risks of security. And you could think of lots of other examples that might fall under this. And I'm happy to think with you about those in a second as well.
Yeah, I'd like to hear from others out there if they see any other value conflicts, or you could even just think of it in terms of compromises, things that are we're having to juggle and find compromise in order to achieve an overall good.
Yeah, you can see the ones we've listed out here, but yeah, if you've got others, we'd love to hear about them, and I will do my best to annotate.
I have a quick thought. I'm not sure exactly what this conflicts with, but it's just sort of a, I guess in itself, you know, distributive justice and thinking about how we distribute resources and healthcare. I'm not sure exactly what the conflict is with that, but I think it's something that in itself, having to decide where, how you do that exactly. I'm not sure how to frame that, but this is that I've been thinking about a lot, just related to like who gets access to what and why. And so, for example, physical therapists are not being allowed to work with patients who presumably really need their care because they don't have enough PPE. So this is a conflict, right? So do you preserve the PPE or do you give patients what they need? And that's something I think healthcare is trying to sort out. And from a rehab perspective is particularly interesting because these patients presumably need a lot of rehab and aren't necessarily getting access to that.
Yeah, thanks, Becca. Just earlier this week, I watched a webinar out of Johns Hopkins University where Jeffrey Kahn, who directs their ethics, really famous ethics center, very famous bioethicist. He's been working with Johns Hopkins and the state to think about exactly that issue. And the way that he described it is what I typed here on the annotation. It's the conflict between distributive justice and procedural justice.
Yeah,
so
that makes sense to me.
Yeah. So if you've got a good sense about, just for others' sakes, right? If you've got a good sense about how fairly to distribute resources, you then need policies in place that do that in a just way. And sometimes those things don't align very well, right? You could imagine a case, and it's sad we can do this realistically, but a case where, you know, you've got to make healthcare rationing decisions in the clinic, and you've got a model in your mind about the way that you can distribute resources fairly. Like, we're not going to give them to patients over 65, for instance. And thankfully, we haven't had to do that in the US as far as I know. But then when it comes down to doing it, how does each clinic or each hospital implement that policy fairly in order to meet the distributive justice concern? And those sorts of conflicts are in the nitty gritty, but I think they're covered under something like the access and privilege line that we'd listed down there. Yeah, and this is where the more you know, the more dangerous you can become about ethics, right? When you've got the distinctions around types of justice laid out pretty clearly, it starts to be really clear about how those play out in the real world. And I think somebody like Dr. Kahn, who has thought a long time about justice, but also now is implementing it in policy, this is where the rubber hits the road for him. And just to share one more story about that webinar, it was really interesting to hear him talk about the ways in which for 4 weeks now going on 5 weeks, he and a team of 10 other bioethicists and physicians have been meeting twice a day at noon and 7 p.m. just to talk about the ethical issues. And they've been doing that for 5 weeks. And because thinking about the ethical issues to that extent can lead them to develop really good policies. And again, I think his is a great example of just what we're trying to do, and getting us to have these discussions is a really important step. Can't develop policies in a bubble, and you can't think about ethical issues on your own very easily. The more you can do it with other people and hear different perspectives, the better. Yeah, that's really good. Other value conflicts that you might think of? Anyone? And I know I promised we'd wrap up in an hour, so.
A couple of quick things, and I think one of the conflicts has to do with the need to make informed decisions on the one hand and radical uncertainty for an indefinite amount of time on the other hand, right? And I think that sort of infuses all of these things. The other thing I was going to say is that with some of these conflicts, for instance, liberty and public good, I think they may be really more about conflicts between short-term and long-term, because it's not at all clear to me that long-term liberty and long-term public good are in any kind of conflict at all. It's the short-term liberties that are in conflict with a long-term public good.
Fair, yeah, that makes perfect sense. So Shelley's introduced thoughtfully 2 other elements that we hadn't considered in our list of conflicts. One of those are epistemic conditions, or epistemic values, which are coupled with ethical values at every turn. So the ways in which we know, and in this case, don't know, the radical uncertainty piece, and the time element, which is really, really important to considering harms or justice or freedoms, a lot of those things. And this is where, yeah, Becca's got a good one too. This is where ethical decision making, which is what we wanted to end on this morning or today, becomes really challenging, because you could come up with a good theory of rationalizing, reasoning your way through an ethical problem, but the real world conditions of time and uncertainty, among others, I'm sure, physical space, another, get in the way. And so all of these things become then contextual in really important ways. Becca says in the chat window that confidentiality versus the good of society, that's another really important one we can add to the. Zoom and I are not friendly. I apologize. Okay.
Just while you're typing, I know you want to move on to the third one, but thinking in terms of us as educators or students, it didn't make our list, but there's also obviously how we manage the values of delivering quality online education, and yet also doing it within the resource limitations, or for instance, maintaining academic integrity, security during exam and testing, and yet providing access. So the short-term mantra for completing the semester has been, let's make sure we give students the benefit of the doubt and try to minimize the pain. But at least in the College of Optics, we're thinking about summer and going forward. Now, how do we do testing, for example, more securely? How do we do it thoughtfully, and maintain the integrity of academic programs? And there's a little bit of debate as to, whether you can even do online testing securely. So it's interesting that there's value conflicts even within our smaller sphere of education.
Yeah, and Steve, Shelley just typed, related to what you're saying, compassion versus gatekeeping, which I think is really.
Yeah, that's a nice way to phrase it. That's right.
So again, this is another sort of important step in the ethical decision-making process. We've identified some ethical issues. We've considered what values are at stake. And then this third step for me, sorry, I have to delete all my annotations. The third step for me are then, how do you make the ethical decision? How do you do it, right? How do you implement the thing that you've thought about? And there's all sorts of strategies here. We could talk at length, and I know I want to keep this brief for many reasons, but most because I want to be respectful of your time. Philosophers are trained in these normative theories, right? If you've taken courses with me, or if you've taken philosophy courses, or functionally any ethics course, you will have heard of normative theories, right? So Kantianism, utilitarianism, an ethics of care, a virtue ethics. We could go on and on. Contractualism. There's all sorts of kinds of ethics. And I know many of my students are working with me either this semester, Sterling in independent studies, or Becca through the certificate program. Other folks have been thinking with me about normative theories and the way they apply, but a lot of my training has been on the ways in which those theories can be applied practically. And I just want to leave you, or one of the things I wanted to say or offer are these 4 steps, these 4 questions you can ask when you're trying to make an ethical decision. So you've got an ethical problem you've identified what values are conflicting. So now how do you decide which way to lean on the conflict? And so here are the 4 questions that I had been given by a mentor of mine. And I just want to share them, and then we can think about them, and we can talk about anything else you want. But here they are. So the first question to ask are, what are the consequences of your actions or your lack of action? And what's the ethical relevance of those consequences? You can see, if you know normative theory, where that's coming from. Second question are there rights that have to be taken into consideration? What are the relevant moral obligations that deal with those rights? Again, coupling with another normative theory. The third question, what virtues are relevant to the situation? What actions would best support those virtues? And the fourth, what relationships are relevant to the situation, and what would an ethics of care require? And if you can answer all those 4 questions, each of which are quite complicated, you've then worked as a pluralist in ethics. You've answered from a number of different normative theories, different perspectives of what the right and the good are. And if you can find a space in which all those answers coalesce, right? And none of them are going to be ideal, but there's a way in which there's a sort of democracy to this process. You can think about, oh, hold on. I'm also admitting people back into the meeting. If you can work through that process, which is really complicated, and answer those 4 questions, you can reach a decision that's reasonable. Now, is it ideal? No. But do we live in an ideal world? No. a lot of what we do in ethics is compromise. A lot of what professional ethicists are doing right now, Jeff Kahn among them, for instance, are making really difficult compromises. These are the reasons why he has to spend with his team a whole work week thinking about particular ethical issues for a single policy, because these are not easy decisions to make. But again, those 4 questions are supposed to enable us to think about the complex ethical theories without having to know who Immanuel Kant is or why Aristotle thought these were the virtues and not others. They give you the language and the terms to then apply to come up with a reasonable answer. And reasonableness, I fear, for me at least, is the best I can normally do. But again, we could talk a lot more about that. There's lots of different decision processes we could think through. We could talk about normative theory. We could talk about bioethics and their principles. But the third step here is you've identified ethical issues, you've identified the value conflicts in them, and now you're reasoning through them. So what I'd like to do now, I know, Steve, if you want to jump in, feel free, but I know we're 3 minutes past my 60-minute promise. I will stay here. The conference is open until 1:30. I'm in no rush to leave, but I know some of you may have to go. So thank you all for joining us today for the Center for Ethics event. You'll hear more from us in the future, and you'll see, you can request a video recording of this conference from me to share as you see fit. Thanks.
Sounds good. Yeah, for those who have to leave, thank you so much for joining us. And for those, and stay safe, everyone. But for those who are still here, as you were talking, Jonathan, one of the things that struck me is how to even move beyond that pluralist approach and even empower people to make good quantitative decisions, for lack of a better word, where you've got to do some sort of value weighting between those different normative theories and then work out exactly how much PPE to allocate here or there. How do you weight those different values? I don't know what the answer for that is. I guess as an empiricist and someone coming out of STEM, I'm always looking for that magic formula. But that's a question that I have. The other one that I have is how we deal with the challenge where maybe knowledge and expertise gives an individual or a small group of people the opportunity to make the best and most informed decision. And yet there can be a value conflict there, because if a larger part of a group who would be subject to that decision and to the outcome of that expertise doesn't agree with it, then they may feel, for good or ill, that their values are being compromised. And so there's this notion between the individual versus the community, and what if the right decision, all good decisions and ethical decisions really require knowledge and information. If the information and the knowledge is so tightly contained within one small group, then can their decision really be considered ethical if the rest of the group doesn't buy into it? I don't know if that changes how any of those normative theories would address the problem at all.
Yeah, so you've introduced two things that we've circled around a little bit. One of those is the sort of link between the empirical and the ethical, or the epistemic and the ethical. So part of the reason why I've appreciated working with you so much, Steve, and our colleagues, and having conversations like this, is because the 4 questions that I answered you, I can answer for any ethical dilemma, but can I answer them well? I'm not so sure, because I don't know a lot of stuff. To be fair, frankly, any stuff. But the stuff I do know is in good dialogue with the stuff that you all know. And I think answering those questions together in a community is how we make good ethical decisions. And the second thing is, I think about the community aspect again. So it's the type of knowledge we have and the community in which we have to answer the question that leads to the sort of practical outcomes of ethics. I think a lot of philosophers, maybe not anymore, but historically a lot of philosophers have ended up stuck in the ivory tower phenomenon, right? Where we close our doors and we think deep thoughts and we write our books and our articles and we try to solve conceptual problems, but we don't end up then solving real world problems. And in fact, applied ethics, or the sort of thing we're talking about today, is looked badly upon by some philosophers, precisely because you can't be as careful as you might want to in developing your argument, because you're bound by the complexities of working with other people in real world conditions. And so some philosophers think applied ethicists aren't very good philosophers because they're not doing the careful conceptual work. And maybe an equivalent is or maybe an analogy would be the bench scientific researcher and the applied scientific researcher. I'm not sure if the analogy holds.
No, absolutely. I was going to say the theoretical mathematician versus the applied mathematician. You know, you can reach purer maths if you're not bound by constraints, but then what do you do with it? Applied math can build a much better aircraft, but needs to put in some constraints because maybe you can't solve that partial differential equation. So, you know, even in the STEM side, I think it's fundamentally, you know, it's natural philosophy. It is those same philosophical tensions. But I liked where you were taking it also, that it really underpins the need for conversation and these kinds of ethical discussions. And in some ways, I think, you know, many have remarked that COVID itself exposes fundamental weaknesses and problems, you know, in society. But one of those is, again, that lack of discourse and discussion, because you cannot get a community to move toward a good solution, a good outcome, unless there's mutual understanding and mutual respect, which doesn't necessarily mean complete capitulation of values in order to move the society forward.
Right, yeah. Does anybody else want to weigh in here? I don't want to, I don't need to keep us unnecessarily, but again, the point of this was to have a conversation with you all. It's much easier to do in person, but there are ways we can do it. I would offer then to...
I'm enjoying it. I'm here as long as you go, so.
Well, Sterling, you know us.
I'm looking forward to this for as long as it came up. You know, you could have put this out a month ago and I would have probably, I don't know, bought a new background or something. I would have, anyway. No, I've been looking forward to it. I'm not locked away, obviously, you know, I'm not isolated because I'm going to work, but no, I've missed the school interaction, obviously. So I'm here as long as you are.
All right. Yeah. Yeah. Thank you all for joining us. This has been really fun for us, at least. There are ways you can continue to connect to the center. We'll be posting some videos and some interviews and some bits about our student presentations as the semester wraps up here, so you'll see new things coming out on the website. We'll have events coming up in the fall and over the summer. Most of those will be virtual, I would guess, along with the university. But do stay in touch. As I mentioned, we had been doing a bi-weekly meeting. Anybody is welcome. We've got a group of 15 or 20 folks who come in and out. It's a chance to just talk about the sort of ethics work you're doing, or to think about questions that you're working on currently. We enable our participants to have space to present their work. Those conversations have been really fun. So that's a small thing we can do to connect. And I don't know, Steve, other things?
That slide, just want to point out, the slide that's on the screen right now shows the email address for the Center for Ethics. It's a good choice. It ought to stick with you. So write it down if you need, but otherwise, you know where to find us. And please send us a note with any thoughts, feedback, or if you want to join us for those bi-weekly meetings or other interactions.
Yeah, and I think, I know Cindy, you had been, Cindy Lou, you've been in and out a couple of times. If you have questions for us, please reach out. You're welcome to talk now. Same for you, Jacob. And Jose and Becca and Sterling, you all are, hello, you all are with us regularly. So. Cindy, do you have questions?
Well, I was in and out, and I apologize. We had a work call. I work with the city of Port St. Lucie, just a little south of Orlando. So I was interested in, I work in the HR department. So I'm looking forward to the recording, because we had a call at noon that took me in and out. So, but this has been really interesting what I've caught up, and I'm excited to learn more. So.
Oh, I'm really glad. Thanks so much.
Yeah, great. Thanks for joining us.
Thanks for having me.
My pleasure.
Jonathan, this was I really enjoyed this too. Thank you very much for doing this.
Thank you, Jose. It's really good.
Thank you. Thanks, Jose.
Jonathan, this is Matthew Jacob. Can you hear me?
Yes, sir.
Yes, I am an adjunct in the Department of Philosophy.
Oh, great. Good to meet you. Oh, you're muted. You're muted now, Jacob. Can I unmute you? Okay, I think you're good.
Okay, I am the manager of Department of Spiritual Care for the South Seminole Hospital. So when ethical concerns came, and we were discussing that, was really of big interest to me, because we face everyday ethical concerns about the patients, the staff, as well as other concerns like public versus private and all that stuff.
Sure.
Very good, really appreciate. Couple of observations that I have as a university teacher is that when the COVID-19 situations came up, many of our students were deprived of many privileges that they had in the university as students. And I have seen it a lot among my students really struggling financially, and many number of other possibilities that they had, like computer access, internet access, they were all broken. They were going through tough times. So I kind of relaxed number of deadlines for them when they reach out to me. And another thing that I would like to bring to our attention is like mental health.
Yes.
Big issue. And a third thing is also the ethical concern and the aspect that we need to pay attention to about the medical care providers. I see it a lot in my hospital here. So how can we look at it in an academic circle? That will be also interesting aspects in the coming days, if you are planning to continue with this discussion forum.
Yeah, thank you so much. Yeah, all of your points are really excellent. I think that the point about, yes, healthcare workers is really important. And I was also thinking, I got a little distracted because though there's a connection that I hadn't made before between your work, your professional work, and Sterling Courtney's academic interests. So there's some connections there I'll have to make between the two of you coming up. The thing that really drove Steve and I to put together this seminar in the first place was precisely because there's such a range of ethical issues that are affecting all of us. So it's not only, as you're describing, not only patients in our professional roles in the healthcare industry, in your case, but also our students. And we didn't even talk about our students' access to technology, but I think that's a point that Shelley Park would be really sensitive to. Our students are coming from, many of whom already, even before pandemic conditions, had problems with housing and healthcare to begin with. Now those problems are exacerbated, and we're asking them to do the same work we'd ask them to do on campus without resources at home. So I think the university has been, UCF at least, has been sensitive to this, asking the faculty to be wary of those conditions and to, as you're suggesting, be a little more careful with grading policies and requirements. But even
and deadlines.
Sorry, say it again.
Deadlines.
Yes, and deadlines, absolutely. But I will say, and I'd heard from a couple of colleagues, we still have heard of faculty asking their students to print off paper copies of exams, fill the exams off, and mail them back to the faculty member. And I think it's things like that that I don't think that those requests are coming from any point of malice. I just think those faculty members aren't engaged in conversations like these, right? They're not thinking about the sort of the values that are driving their academic work versus their students' needs. It's a perspective problem. So I'm really glad you're here, and really glad you're in the department. And I'm sorry we hadn't met yet, but very good to meet you now. Yeah.
You know, I live in a virtual world as far as UCF has been concerned. So
Fair.
Thank you very much.
in some way. And here's another good example.
Are you interested to continue this this forum, or is it just once for all?
No, I'm happy to. I think Steve and I are both happy to continue it. We had sort of done this as a trial run to see if there was interest. Again, we can't now meet in our normal biweekly way, but if there's interest, there's no reason why we couldn't continue in something like this.
And we'd love to have some feedback, from teachers like you, students, non-traditional students that are working a full-time gig and also studying. What are the best times to hold one of these events? Is the weekend better? Is a weekday? After the work, by the time 5 p.m. or 6 p.m. rolls around, I'm off and done. And I can imagine many people would be as well. And yet that's maybe when they'd be most accessible. So it'd be great to have some weigh in from participants on when should we do the next one and what time frame, that sort of thing.
Yeah.
Thank you.
So Dr. Beaver and Dr. Kubler, I was one of the aspects when you all were talking about the laboratories and aspects, or access to that at the university. I have no idea how many labs there are and how people, the intake or whatever, but I know when it was in the early 80s, my classroom lab setting would have been very much like what I work in at the Oviedo ER. And although I'm the only laboratorian, the whole setting of the place is very much like, not much, the size and everything's not much different than what I had at UCF. So our intake policy is a model for getting in to that atmosphere safely. I feel it's safe. I go to work. I'm not front line. I'm, I guess, second line. Nurses are front line. They come to me. So I'm not completely exposed like a nurse would be. But having said that, we all enter the facility. I think we all feel very safe as we enter. Of course, the intake of the patients is what's more critical, because but as we enter, they do a temperature scan. If we've got a normal temperature below 100, we're good to work. We go on in. And I could see that I could see a manner that this could be applied. Like I said, I don't know what the laboratories look like at UCF or how many laboratories there are or how that intake would be, but I would think that this is a model for intake of students into access to laboratories. I just leave it at that.
Yeah, the two things that I would add, I'm sure Steve can weigh in here too, but one of the concerns I'm sure UCF has is that our laboratories are so diverse, right? So we have lots of different types of laboratories with lots of different types of access and settings and equipment. And the other thing to say is I'm really kind of surprised that the temperature scan is the go-to test of your okayness, given that so many COVID-19 carriers are asymptomatic. Again, this comes back to Shelley's point about sort of epistemic uncertainty. There's a lot of stuff we don't know about this virus. And so it seems like if you've got nothing else, the temperature scan is great, right? But there's nothing to guarantee that's preventing you from being a COVID-19 carrier, Sterling, and then going to work, right? That you'd be able to go in and out. But you've also got, I'm sure, different wipe down criteria and decontamination.
Oh, no, we're very sterile. I mean, clean constantly. There's lots of hand wash and everything like that. And they hand us a face mask if we don't have it. We're actually supposed to use the same face mask for a week. But yeah, that type of thing. But I have no fear whatsoever. I go in and I have no, and as far, the temperature scan, and of course the employee is, hey, well, I guess my temperature's normal, but I have had this cough, that type of thing. No, but basically everybody that enters feels pretty good. And I've never felt better.
That makes sense. Yeah, the conditions are the conditions between a hospital where COVID-19 and its symptomology is on the minds of everybody who enters that facility is probably quite different than, just to pick on Steve, right? An optics laboratory where people are thinking about lasers that pew pew, which is what I think of when I think about Steve's work, of course. The pew pew lasers thing is very different. So maybe students coming into that lab won't be as cognizant or as careful. So I think the university has to be really cautious, and they have to be cautious again for a couple of value-laden reasons. One, they want to protect the health of the students and the staff, but also they don't want to get sued, right? So the rollout is complicated, hence why Dr. Reinhardt said there's a task force working on it, and why we're likely going to be closed down pretty tightly for a while longer. Yeah.
I'm not questioning that, and I don't know how you would democratically choose which labs get to open and which don't. And then of course, Dr. Kubler's situation in the lab, can you safely keep a 4 to 6 foot spatial distance between you? Whereas when I was in school, yeah, we could have managed that easily. Everybody do their own thing, and yeah, I was just throwing that out there that I've got a model that works and we feel pretty safe at it.
Makes sense. Yeah.
I'm thinking if I can shoot COVID with my laser, I can get my lab open, right?
Yes, that's the way to do it. More lasers.
More lasers, yeah. Sometimes it's just thinking ahead. Maybe I'm in a fortunate and lucky position, but I know a colleague at University of Texas, El Paso, who did similar. We started thinking kind of in January or February, and I had this conversation with my students, what could happen? So, one student who's early in the program is working on writing and basic research tasks and getting ready for candidacy, which in our department is done as a proposal on a separate topic from their research. So it's all literature work. So he's going to focus on that. Another student is doing lots of experimental work, but had been doing some simulation. And so we went full tilt into simulation. So I'm actually busier than ever. But, it was just thinking down the road, this might happen. And that's not going to work for every discipline, for sure. But I have colleagues in chemistry, and my hat's off to them, who are doing just synthetic chemistry. So all their kids have to be at the bench. And, this one individual of whom I'm thinking has been very rigorous about it. And a week before the university closed, he said, get ready. We're going to probably have to shut the lab down, figure out what your home research tasks are going to be, literature work, write-ups, and things like that. And so he's been sticking to it. I think it takes a bit of sacrifice and rethinking for everyone to do this. And we just have to hope it's not as protracted as it could be, particularly if we let off the steam of controls too early. Right?
I just had one other thing. Oh, I'm sorry, I'm muted. So there's one other thing that's come up that I think is kind of interesting to think about from an ethical perspective. So, and I kind of alluded to the fact of some of the workforce issues we're having in physical therapy and people not having access to patients, but there's a whole other issue of people not wanting to work with patients who have COVID-19, which is a totally separate ethical issue related on the provider side. That I honestly didn't expect people to feel that way, or that there were going to be high level discussions about whether or not, physical therapists would be an integral part of the team of people who would work with COVID-19 patients, which I find fascinating, and I can understand where the fear comes from, but it's also something from people who are caring for people with COVID-19, you would hope that they would understand the need for that. So that's, I just was actually kind of surprised. I don't know if that was on your guys' radars, things that you've heard from providers that they're not necessarily wanting to participate for the fear of their own family, which I know you hear all the great stories about people who are like isolating themselves from their family and doing the right thing, but there's a bunch of people who maybe aren't doing that or don't want to do that.
Right. Yeah, that's super interesting. That hadn't been on my radar, but I can think of several historical examples of the exact same thing. And part of this, I think, is driven by the uncertainty. Like, we just don't know enough about the virus for people to feel, as Sterling, except for Sterling perhaps, for healthcare workers to feel safe enough to make those decisions. And I can think, even when I was young, the HIV/AIDS epidemic, people were still in that space of the cultural space of epistemic uncertainty, where we weren't real sure, like, the conditions under which this particular disease progressed and transitioned, and there's still a lot of social anxiety about it, which went away in my lifetime, right? I think the same thing is going to happen with COVID-19 as we learn more about it. Not only as we learn more about it, but as it just becomes part of our social fabric, because it's not like it's going away. And
there was a discussion that came up on a forum that I was part of asking employees to return back to work from an HR standpoint, and the risk of what do you do if they don't feel comfortable, and are you at risk if you don't provide reasonable accommodation? Then are you at risk of a lawsuit? Are you opening your organization up to a lawsuit if your employees don't feel comfortable? Like, to what degree do you have to prepare for that? And it was something I hadn't really thought of, that coming back to work is going to look different for everybody, and coming back to the labs at your school as well. So
yeah, that's right. We've got one person in a waiting room. I'm going to admit them, but just a heads up, if we all of a sudden see a bunch of pornography, it's totally my fault. This Zoom meeting will close by itself at 1:30. So I wanted to just thank you all again for your participating. I think it's a really great idea to do more sessions like this, even if they're just chances to talk. You saw that the presentation we put together, the thinking we've been doing, was really quite simple, but it was a way to get us all thinking together about ethical issues of the pandemic. And I hope at least this webinar has done that amount. So thank you all again for being here. If you have any final thoughts, let me know. Otherwise, we will see you next time.
Yeah, we appreciate it. Stay safe and healthy out there.
Yeah.
Thank you.
Thank you.
Well,
And stay connected.
Yes.
Yes.
Bye, everybody.
Thanks.
Bye.
Bye.